So this is our 90-90 hip mobilization. So from here, I'm gonna get in to our 90-90 position, which basically just means that our knee and our hip is in a 90-degree position. So my front leg here, 90-degree angle at my knee, and my back leg is 90 degrees angled as well. When you're in this position, if you feel any pinching pain in the back hip here, just move your knee forward slightly. And if you feel like you got good mobility in this pattern, then you can challenge yourself by pushing your foot backwards, but still keeping that 90-degree position. From here, I'm gonna take one hand on each side of the front leg, and then imagine that if you could shoot a laser pin out of your belly button, then that laser pin should be pointing towards the top of your knee here. So we don't want to rotate it this direction, and we don't want to rotate it towards our shin, but try to rotate it all the way out towards our knee. From that position, I'm gonna get into a perfect posture. I'm gonna lift my chest up high, and then I'm gonna lean forward from the hip. So I'm not trying to get my chest closer to the ground, rounding my back, because then it will lose tension in my hip down here. So chest up, belly button towards the knee, and then lean forward at the hip. So my belly button actually gets closer to the ground. That's the picture here. Belly button closer to the ground. Then I'm gonna find the best stretch position. And when I say that, I mean find a really good position where it stretches really nicely around your hip. It could be on the side of your hip. For some people, it's on the inside of the hip. And maybe some people actually also feel it on the back hip here as well. So that is more individualized depending on where you're tight. That's how you should think about it. So lean into it, find a good stretch position, and then we're gonna hang out here for 60 seconds. Just breathe slowly. In through our nose, exhale with our mouth. Maintaining a good posture. And then while we hang out here for 60 seconds, then the goal is to just relax into the position. So our brain feels comfortable just being in this position, because we're gonna do some pretty hard and intensive mobilization here in just a second. If we can get deeper into the stretch during this first minute, that's perfectly fine. We're continuously just trying to find the deepest possible position where we can maintain a slow and controlled breathing. After we have stayed in this position for 60 seconds, then we're gonna move over into our contract relax method. So from here, I'm gonna take a big inhale through my nose. Then I'm gonna hold my breath for 4 seconds while pushing the front knee into the ground as hard as possible. Hold for 4 seconds, and then exhale and relax. And try to get deeper into the stretch. So the same here as with our other mobilization exercises where we use the contract relax method, is that the first rep is our warm-up rep. So we don't want to push as hard as we can on the first rep. We're gonna ease into it, and then from rep to rep, we're gonna build up that tension every time. So 4-second inhale. Hold your breath and contract. Really push the knee as hard as you can into the ground. Exhale for 8 full seconds and relax into the position. If you're moving just a millimeter closer to the ground for every time you exhale, you know you're doing it correctly. Make sure while you exhale and when you get deeper into the position that your back doesn't start to round in order for you to get closer to the ground, because then we'll lose tension in the hip and we won't get the same effect. So make sure to keep your chest high, belly button towards the knee, so when you move into the position, you maintain that good posture. That is our 90-90 hip mobility.